Breast cancer is the most common cancer affecting women globally and in Nigeria. Therefore, it's a concern to many women. But knowledge is power, and today, let's explore some risk factors and actionable steps you can take to promote your breast health. I'm going to talk to you about risk factors, and I want you to have two things at the back of your mind. The first is there are some risk factors we can control, and there are some risk factors we cannot control. So while some risk factors for breast cancer are out of our control, there are steps we can take as women to potentially lower our risk. Let's start by understanding these risk factors. The first is your age. As women age, their risk of breast cancer increases. As you know, there's nothing we can do about aging. The goal in life is to age. Number two risk factor out of our control is family history. Having a close relative with breast cancer can elevate your risk. Again, women cannot choose the families they are born into. In some families, there's a very strong history of breast cancer. Another risk factor out of our control is genetics. There are certain gene mutations that can increase susceptibility to developing breast cancer, and these genes can be transferred from a mother to a child. Dense breast tissue. Some women have very thick breast tissue, and this is what we refer to as dense breast tissue. This tissue can make it harder to detect abnormalities on mammograms. Hormonal factors. Starting your menstruation earlier than usual or achieving menopause at a later age are both scenarios we cannot control when a girl will start menstruating or when a woman will stop menstruating. But we know that the longer a woman is exposed to her menstrual cycle, the higher the risk. And it's just a mathematical example I will share here with you. So let's talk about two ladies and their menstrual history and how it relates to breast cancer risk. So Lady A started her menstrual period when she was 8 years old. In our medical world, we call this menarche. And she achieved menopause, which means she stopped menstruating at the age of 68 years old. And so she has a 60 years menstrual history. And that means she's been exposed to various hormones for 60 years, such as estrogen and progesterone. And so this simple math says Lady A was exposed to these two hormones throughout her 60 years of menstruation. Let's look at Lady B. She started menstruating, let's say the same age, also 8 years old. However, she stopped menstruating at a later age, at 72 years. 72 years old was her last period. And so if we deduct 8 from 72, we get 64 years. And so Lady B was exposed to the same hormones for 64 years. What this tells us is Lady B was more exposed by 4 years to estrogen and progesterone, and that means she has a higher risk of developing breast cancer. Now let's empower ourselves with actionable steps. The first thing you can do is to maintain a healthy weight. Being overweight or obese increases the risk of developing breast cancer. Stay active. Regular exercise has numerous benefits, including potentially reducing breast cancer risk. A healthy diet is critical. Choose a balanced diet rich in fruits, vegetables, and whole grains. Limit alcohol consumption. Excessive alcohol consumption can increase the risk of breast cancer. We encourage women to breastfeed because studies suggest breastfeeding may offer some protection. Know your family history. Talk to your doctor about your family history. Regular screenings. Schedule your mammogram if you are above age 40. Your self-exams should be performed every month. It's important you're familiar with your breasts. And talk to your doctor to discuss your concerns or your individual risk factors so that your doctor can create a personalized plan. By understanding your risk factors and taking proactive steps, you are empowering yourself to take charge of your breast health. Open communication with your healthcare professional is key. Remember that early detection is crucial. If you notice any changes in your breasts, don't hesitate to schedule an appointment. Breast cancer is a serious topic, but knowledge and proactive measures can make a difference. Together, let's create a supportive community for breast health awareness. Knowledge is power. Take control of your health, embrace a healthy lifestyle, and prioritize regular screenings.